The debate over reproductive rights rages on in South Dakota, with Planned Parenthood and the ACLU challenging a law which would require a 72-hour waiting period before a woman can receive an abortion. Hello and welcome to Comcast Newsmakers. I'm Candace Kelly, and joining me to discuss reproductive rights in South Dakota is State Senator Angie Buhl. Thank you so much for being with us, Senator.
Thank you for having me.
Now, first of all, this is actually a collective of bills. Explain to the public what these bills are trying to do.
Ultimately, these bills are trying to be an end run around an abortion ban in South Dakota by creating a set of barriers to receiving an abortion. So they create waiting periods, they force women to go to anti-choice, what are called crisis pregnancy centers, and ultimately to delay women past the point of being able to get an abortion.
Now, I've spoken to you before. You've said that these crisis centers have unlicensed counselors. Tell me exactly, though, what they tell a woman and what a woman goes through and that creates this barrier.
Sure. So when a patient goes to one of these fake clinics, they will see an unlicensed volunteer counselor who may have received a couple of hours of training, and they give out inaccurate medical information about the risks associated with an abortion, linking to fake studies that abortion increases the chances of breast cancer and things like that.
So I know that on the other side, certainly opposition is saying, you know what, we're just giving the woman a little more time. And what is the matter with a little more time? It is ultimately her decision. We just want to have our role in the process.
I understand those concerns, but the problem with a little more time are a couple of things. Number one, women don't come to this decision lightly. I don't know of any woman who had an unplanned pregnancy and lightly decided to terminate that. Women talk to people who are important in their lives, partners, family, pastors, and people like that. And so they already take that time to consider that. Additionally, because access to abortion is so restricted in South Dakota, we only have one clinic, and we actually have to fly a physician in once a week to perform abortions. There's already so much longer of a waiting period as it is.
Wow, that's amazing. Just one clinic.
Just one clinic.
So I would imagine that you have a lot of women who are supporting your efforts, especially with just one clinic, as you mentioned.
There are a number of women who talk about the importance of being able to access abortion care, and they really want lawmakers to focus on issues that matter to their daily lives and stop making everything about abortion all the time.
So let's talk about this bill, and the lawsuit in the ACLU challenging the law. What's going on, and what are they saying about it that makes it illegal?
Well, after the law was passed by the legislature and signed by the governor, the Planned Parenthood and the ACLU filed the lawsuit to stop the law from going into effect on July 1st and to hopefully overturn it. So there will be a number of issues that the court is looking at, including how this fits with federal privacy regulations on health care with HIPAA laws, and especially given that it forces women to disclose private health care information to a third party. They'll also be looking at basic rights to privacy and whether states can force women to go through these hurdles in order to receive an abortion.
And are you speaking specifically of those at the crisis center because they are licensed and they're disclosing information to them?
Exactly, because there's no state regulations over who has to be employed at a crisis pregnancy center, over what they have to say, or over how they use the information that they get from women and who they can disclose that to.
You know, it's interesting that the crisis centers even exist to begin with, and I'm wondering how that even happened if they are unlicensed and they're just counselors with a couple of hours of training.
Well, exactly, and it really is part of a movement that we see all over the country. It's anti-choice fake clinics that are intentionally set up to mislead women, to talk them out of getting abortions, to scare them out of getting abortions, and ultimately to trap them into carrying a pregnancy to term that they don't want.
We have about 20 seconds. How far along is this ACLU challenge at this point?
So it's in the really early stages. It was just filed last couple of weeks ago, and so the judge will decide whether or not to issue the injunction, but it's going to take a while.
All right. Well, we have to have you back for an update. Interesting subject. Thanks for the update that you gave.
Thanks so much.
And thank you for joining us for this edition of Comcast Newsmakers. I'm Candace Kelly.